give me 1 second.
I hope I'm showing up because I can't
1
see
second.
myself. You are. Okay, thank you. Okay, thank you very much. This is the Health and Human Development Committee meeting with the St. Louis Board of Aldermen for Thursday, November the 30th at 9:00 a.m., 8:59 a.m. And Madam Clerk, would you please call the roll?
Alderman Balmer,
Present.
Alderwoman Tyus, Alderwoman Schweitzer,
Present.
Alderwoman Sanye, Chair Boy,
Present.
Alderwoman Tyus, Alderwoman Sanye. We have 3 present. We have a quorum.
Thank you very much. Could we have approval of minutes, please?
I move we approve the minutes of November 16th, 2023.
Second.
Would you call the roll?
Alderman Balmer,
Aye.
Alderwoman Tyus, Alderwoman Schweitzer,
Aye.
Alderwoman Sanye, Chair Boy,
Aye.
Alderwoman Tyus, Alderwoman Sanye. We have 3 aye votes.
Thank you. So we have no board bills for review, no resolutions. Our discussion is a disturbing information that probably everybody has received. The sexual transmitted disease, the numbers are going up. And so we have today Dr. Mahdi with the health department that will speak to us in regards to this. Dr. Mahdi. I know I see her on the screen, but I don't see her face.
She was on there earlier.
I know, I thought I saw her.
Let's see.
Pardon me, Alderman Boyd. She's in a current meeting right now. She'll be on momentarily, okay?
Okay, so is it somebody that that can start for her?
Not at this moment, but she's on her way. What was my name?
Okay. So I don't know if you all heard the information, and I hate it when we get it through the media. That drives me crazy. And so it was through the media, and ironically, it was a high number of sexual transmitted diseases, and the county numbers were very high. And so I reached out to our health department to ask in regards to our numbers. And Dr. Mahdi said that she would be honored to come speak to us in regards to our numbers. So there she is. Hi, Dr. Mahdi.
Hello, everyone. Apologies for my tardiness. Good to see you all.
Good to see you too. And so we were just talking about the numbers from the STDs. And so I told them that you would be able to give us more in-tuned information in regards to that. So we are now having you come forward to speak to us in regards to these numbers. Now you're on mute.
Absolutely. I haven't had my coffee all the way. Absolutely. If someone could please give me permissions to share screen, I have some slides prepared.
Did we give them the
Yes, you just did. Thank you so much.
You're welcome.
Good morning, everyone. I miss seeing your faces. I thought I had defended this esteemed committee. I haven't seen you in so long, so it's great to be back. There's a lot going on in health right now, and I'm so thankful that you all are in your leadership positions paying attention. There are 2 main issues that if you haven't seen in the news, is prominent right now for health. And one of those is what I'm addressing today, but the other is the maternal child health indices that were also released by the state, that we have always, unfortunately, not been high in the state of Missouri, but the numbers were even more alarming. I would be happy to come back and speak about that too. But my team, in the monthly reports I send you, we try to make sure that you get some information for your purview about that. But in addition to that, I'm happy to come here and share with this esteemed group. So I'm gonna speak briefly about the state of STIs in the city of St. Louis, and then leave time for discussion and questions. Can everyone see my slides?
Yes.
Okay. So today's objectives for this meeting is to describe the trends and costs of major sexually transmitted infections in the United States, to compare national and state rates of chlamydia, gonorrhea, HIV, and specifically syphilis to those of St. Louis City, and then to describe to you the programs and initiatives the City of St. Louis Department of Health is planning and implementing against STIs specifically. So we're going to start off by reviewing the national trends just very briefly. In the United States, over the last 5 years, new infections of STIs have continued to increase. Ironically, the new cases of chlamydia actually went down by 3.8% compared to 2017. However, the 1.6 million new chlamydia cases in 2021 were more than the cases of gonorrhea and syphilis combined, and at very high rates per the CDC. These two STIs have dramatically increased over the past 5 years. So in 2021, there were more than 700,000 new cases of gonorrhea, which is a 28% increase in cases since 2017. So it's worth noting that the CDC explicitly stated that any interpretations of STI data from 2020 to 2021 should be cautiously evaluated due to the impact of COVID-19. However, even with that in mind, these numbers should alarm you. In addition to the other STIs mentioned previously, HIV and AIDS infections remained a heavy burden on the US population. Within the United States, there were an estimated 12 million people living with HIV, as well as 31,000 new HIV diagnoses. In contrast to other sexually transmitted infections with federally funded programs, however, the incidence, so the number of new people with a new diagnosis, decreased by 7% from 2017 to 2021. So I wanted to give you the overall landscape. And for those of you who aren't as nerdy as me, the take-home point is this is significant disease burden. These are significant high numbers. So now let's shift to STIs, sexually transmitted infections in Missouri and in the city. So let's start with chlamydia. From a state perspective, Missouri ranked 16th, way too high, in the nation for chlamydia infections, with 31,915 cases in 2021. The city of St. Louis accounted for over 3,000 of those cases, and unfortunately, this translated to a rate of 1,228 cases per 100,000. So for every 100,000 people, more than 1,000 have chlamydia. Very alarming in our city, which was more than 2 times worse than the statewide national rates for chlamydia that year. So we have a higher burden in the city by double than the overall state. Syphilis is my greatest concern, and we'll talk a little bit about why. Missouri ranked higher than other states. Missouri ranked 13th in the nation for gonorrhea infections, with 15,700 cases. Again, the city of St. Louis accounted for 2,319 of those cases, which translated to a rate of 779 cases per 100,000. And that rate was nearly 3 times worse than the statewide national rates, right? So again, if numbers aren't your thing, if you haven't had your coffee like me yet, the take-home message here is Missouri isn't doing well. We're in the top 15 of states in the country. And for Missouri, the city has double and sometimes triple the same kinds of rates than the overall state. From a state perspective, Missouri ranked 12th. So it keeps getting worse for syphilis and secondary syphilis infections, right? When taking into account all syphilis infections, so that's congenital, babies having syphilis. And let me just stop here and tell you that we used to not even see syphilis in babies. As many of you should know, I'm an infectious diseases doctor by training with a public health degree. This is all I took care of before I walked into my first day at the city. even talking about congenital syphilis was not something that I was accustomed to doing for a decade. And now some of the statistics I'm about to tell you, we are now seeing babies being born with syphilis. That causes blindness. It causes brain damage. This is serious. And of course, because of health disparities, the burdens are higher in Black and Brown communities. We must not tolerate this on behalf of our babies. So in the city, the total number of cases has risen in the state to 3,780 cases for Missouri in 2021. And in the city of St. Louis accounted for 599 of those cases. Unfortunately, this translated to a rate of 201.2 cases per 100,000, which was more than 3 times the statewide and national rates for syphilis that year. And let's talk about 2021, folks. What were we dealing with? We were in a pandemic. So where most folks were on lockdown, where most folks weren't outside, as the youth say, right? We were still having numbers this bad. So what more now that we're in a post-pandemic state and people are more active, more social? This is an alarm that we need to send out, and we need to take this seriously. So now it's with great sadness that I have to talk to you about something that shouldn't even exist and is back on the rise. If you don't like numbers again, please look at my screen right now, and please look at that red curve. Look at the steepness with which it's gone up for syphilis in our babies. From a state perspective, Missouri ranked 12th in the nation again for congenital syphilis with 66 cases in 2021. By comparison, the United States had 2,855 cases of congenital syphilis. And this is now reflects what the CDC is calling a national surge in congenital syphilis. A national surge. The CDC does not use those types of terms lightly. Locally, the city accounts for 11 cases of congenital syphilis that year. And unfortunately, and please, if you're not paying attention, responding to emails, this translates to a staggering rate of 797.8 cases per 100,000, which is more than 8 times worse, 8 times than the statewide national rates for congenital syphilis that year within a global pandemic. From a state perspective, Missouri ranked 34th in the nation for HIV infections. This translated to 35.9 cases per 100,000 in the city, which was more than 4 times worse than the statewide rate and more than 3 times the national rate for new HIV diagnoses. So we have more proportions of HIV in this city than the state, and then in general in the whole nation, by 3 times as much at the national level. I have a lot of maps that I'm not going to spend time on this morning because I'd rather talk about questions and get into discussion. I also, unfortunately, do need to leave by 9:45 to head over to the mayor's office for an urgent matter. So I will provide these slides to your committee. You should know, and you should be looking at our website that we keep active now, that we have heat maps that you can use if you're a visual learner and you want to include them in your websites. But it's worth mentioning how chlamydia has changed in certain zip codes over that time. Over the past 5 years, you don't even have to guess it, folks. The northern side of the city has carried the highest burden of chlamydia incidence rates. So you can see where the darkest blue is on this map. We keep that kind of data. And if you look at it consistently, 2017, 2018, 2019, 2020, 2021, 2022. When I joined the city, we only had 2 epidemiologists. This is why I really focused on recruitment and retention, and I filled our epidemiology bureau with 10 epidemiologists so that we always have the highest level of data available to the city and to you. And this is why this is important. Worth mentioning here, gonorrhea has changed in certain zip codes. Again, north side, higher. Syphilis, north and east side, higher. HIV and AIDS, right? You see a little bit more distribution, but where are those darker areas? North side, higher. So let's move into a brief discussion about what programs and initiatives the Department of Health is doing to address this. We are using innovative approaches. So DOH works to make HIV testing more convenient through an innovative program called the Take Me Home program, where qualifying residents can have kits mailed to their home to avoid stigma, to overcome social and structural determinants of health, so that they can self-test in the safety of their own home. They can pick up tests here at Department of Health and at referral clinics. We've put out over 601 tests ordered and delivered across the St. Louis region, and 941 kits have been hand distributed in 2022. My small but mighty team put out close to 1,000 that they hand delivered. 421 alone we passed out during our recent 2023 Pride weekend. Testing kits have resulted in 1 confirmed positive case. So it's worth mentioning that people being able to do this in the dignity of their own homes, we've actually been able to get a case and link them to services. We have a direct website that allows clients to schedule a testing appointment and sexual health resources. We revamped, my team actually created the first ever of its kind independent website called the healthstopstl.com. My homework for you, and you wanting to be a partner to me, is everyone on this committee, please log on to healthstopstl.com today and just check it out. And maybe send me an email to say, did you like it? What was missing? Is it a strong website? But we have that. We also launched an independent social media pages just for the Health Stop to address STIs for over a year. So at the website healthstl.com, someone can book a Health Stop clinic appointment right here at the health department. 5,500 appointments that we've done from February 2019 to July of this year. You can learn more about HIV, STIs, and PrEP. You can find at-home kits, and you can find we've listed 28 other partner organizations, so that even if you don't want to deal with us, we don't mind, but we give you every resource for the other 28 organizations in the city that do similar services and also treat. We connect you to local resources for various community needs, and we locate for you on this website where to get free condoms, one of our 83 partner sites that we also list on that website. We have brochures to educate people on how to use the test. So here is a copy. So when you get an at-home test kit, you also get a brochure with next steps, depending on your result. So it helps you navigate a negative result, a positive result, or even an indeterminate one. For congenital syphilis, for STI initiatives, we have started a lot of outreach initiatives, more than 2,500 residents engaged through outreach and education in the city. We have purchased 2 mobile vans thanks to ARPA support, and you can see them there. We've wrapped them around with our logo, and they're all around the city. And we've provided testing at local nightclubs, bars even, because we have to meet people where they're at and where the most high-risk folks are at. We've educated the community through site visits to schools and congregate living facilities. We have over 31,000 safe sex kits distributed, and we hosted a 2nd annual PrEP week in October 2023 with a mayoral proclamation to really bring visibility to this issue. Congenital syphilis, as you heard me say, is what I'm most concerned about. So demographic and social vulnerability index factors show pregnant women with syphilis in the city of St. Louis, 86% have had a previous STI of pregnant women. 50% have little to no prenatal care. 59% have a history of substance abuse. Rural cases can be explained by a rural to urban pipeline for recreational illicit substance purchasing. Sex is often commodified in the purchase of illicit substances. So there's a connection here to our new Behavioral Health Bureau. And so they work very closely. Statewide, there are calls to screen in the 3rd trimester to treat before delivery. So the Missouri Center for Public Health Education is convening a statewide advisory group to author best practices. Regionally, we are now part of a brand new task force with the city, the county, hospitals, and clinics. Funding has been sought and is being received. And right here in the city, clients seen at the Department of Health are unable to receive treatment because I haven't had clinical services. I inherited a health department without clinical services, right? As you all know, we have just under 1% of the city's budget. And so we're really working and advocating for more support for public health in our department to bring back critical clinical services, because I would like to be able to just treat people when they come to get tested here. Instead of sending them to another clinic, I should be able to treat people on site. So DOH is hiring a nurse practitioner with the goal of providing treatment in our health stop and where women live. The communicable disease has a community health worker who will be able to accompany the nurse practitioner and provide social services. And again, we have those rapid tests that we can provide people. So my final thoughts to you this morning are, this is a crisis. It is a crisis nationally, as the CDC is calling this surges. We've seen numbers balloon in a global pandemic where they should have been lower. And in a post-pandemic state, we should be concerned. But you should know that through my leadership in the Department of Health's active leadership, we are really doing the best we can with the resources, sometimes limited resources we have. But I would now like to open it up for questions. And I thank you. My references for the data are on this slide when you get it. And then I'm just going to leave this up for those of you who are not following us on Facebook or Twitter or Instagram, and we've just gone live on LinkedIn. There is no excuse. I expect as our partners and advocates, you are retweeting, you are commenting on, you are sending out to young people who are the highest demographics for a lot of these on our behalf. So please be following us on at least one of the social media platforms. I'm an auntie. I don't like being on social media. I do it daily so that I can reach my community as your health director, and I would encourage you to do the same. I will stop here and I will ask for any questions or comments.
Thank you so much, Dr. Mahdi, for that powerful presentation and eye-opening. Alderman Balmer, do you have any questions?
There we are. No real questions. I thank you for your multitude of information you provided us. It is. I'm guessing, your feeling is this is a why it always happens in the poor communities, but this lack of education, lack of knowledge, lack of, I guess, family units where they discuss these things. Is that the main problem where this comes in sometimes?
It's such an excellent question, Alderman, and you're absolutely correct. But even more so, in the same zip codes, we see historic and systemic issues that are historic and current. We see a lack of health literacy. We see a lack of education. We see social and structural determinants of health that then compound this. What do I mean by that? If you don't have a car, if it takes 3 modes of transportation for you just to get to one doctor's appointment, you don't prioritize those. On average, folks in impoverished neighborhoods walk to a bus stop, to take a bus, to take it to another bus, to then walk in the winter and snow. Is that going to compel someone to prioritize health? Food insecurity, the inability to pay rent, the need to have multiple jobs. And so healthcare isn't even a priority, number 1, 2, 3, 4, and 5 for many people, because they have to compete to think, well, do I prioritize my bills? Do I prioritize food? Do I prioritize clothes for my kids? Do I prioritize trying to get from A to B? Do I prioritize my mental health? Do I even understand that this is happening? Do I even have a mental, a doctor? Do I trust doctors and government people because I've been treated poorly, and historically we've been treated poorly as well? There's so many compounding issues, Alderman, and that's what makes this even worse. And I will say to you, it's why Missouri has been consistently in the bottom 5 for maternal child health. We see many more Black and brown communities with these issues. I can come back, I can give you, and there's data that my team provides in those monthly reports that shows that this is even greater. But that's such a great point that you highlighted. It's everything you said and more.
All right. Thank you so much. No comments or questions. Thank you so much for your time.
Thank you, Alderman Balmer. Alderwoman Schweitzer. I know she was there. Okay, Alderwoman Sonye.
I just want to thank the chairwoman and Dr. Mahdi for giving this presentation and sharing this information with us. I definitely think, when we talk about why these things are the way they are, for a multitude of reasons, I definitely think it's just kind of a manifestation often of the impacts of racism and the impacts of being poor. I would love to just hear more about your mobile vans, because I know we had some conversations earlier in budget where you were just still working on procuring them. So I would just love to hear more about that, and also about what does it look like to expand clinical services in the city.
I'm so thankful for that. It's so good to see you, Alderwoman. You're such a champion of public health and of the health department specifically. So would love to expand on that. Through the advocacy and support of many of you, especially through our budget process, we instituted a new leadership position. I'm so happy to say that we have a new community outreach manager whose entire job will be dedicated to focusing on community outreach, developing external and internal calendars, working with your board to develop strategically planned community events, and we'll work on keeping up the mobile van, hiring utility workers to drive it, having our partners have MOUs to be able to also utilize the mobile van, so increasing the reach of them through community-based organizations that don't have capacity or access. So there'll be a calendar where maybe on Tuesday, Dr. Punch and the T are using it. Maybe on Thursday, a Reverend Gray and his team are using it, maybe on a Thursday. So we're really working to make it also collaborative with partners, but having a manager who's now going to be overseeing my communications bureau and being thoughtful about programs, using data to inform programs. We're creating an external calendar. I want to know every single public health event so that we don't replicate and dilute efforts. We partner with people to know, I'm going to have a calendar all year round that says, on Saturday, there's going to be these different scope of public health. We've decided to do our own thing, or we're partnering. We're thinking ahead, not being reactive. Sometimes I spend money on a table and 2 people come because we weren't aware that Harris Stowe is having a huge medical event that we should have been at. So we're working on an external calendar. We're also working on an internal calendar. So every bureau will have to have approved through me strategic planning around where we are in community at what time. We've already started one-on-one with every single board of our alderman person will be receiving an invitation to meet one-on-one with us. We've met with 2. All of you will be getting an invitation to get us to come to you, to neighborhood meetings, to ward meetings. And then lastly, we're increasing our community outreach through those vans by using them just to even be at community events, but to then grow. So the reason why I'd like to bring back clinical services is I'd like to have a van where I put a nurse, a social worker, a community health educator, and they come to your wards. We bring care to people because we know one of the barriers, like I said, is transport or trust. So if we come in a mobile van and we can easily check your blood pressure, check your diabetes, check your medications, we can give you a shot if we test for you. I think this would be so innovative and powerful. So there's a beginning plan, but there's a growth plan to supplement that as well.
Thank you.
Any other questions? Okay. Alderwoman Schweitzer.
Thank you so much. And thank you for assuming there's something happened when I was gone. I was so interested in the conversation that my computer died. And I was like, oh my God.
Well, you were smiling at me and it was very encouraging. I get anxious when I do PowerPoint, so it was really nice to see as well. So thank you.
Yeah, I understand. And I definitely do that because I've been in your shoes and I think it's important to show interest. And anyway, so interested my computer died. I apologize. Thank you all for understanding. So you mentioned the behavioral health work that's being done in one of the slides. Can you expand on that a little bit?
Oh my gosh, I'm so excited. So these one-on-one meetings that we're having, we've already met with Alderwoman Boyd. We met yesterday with Alderwoman Spencer. So each of you will be getting an individualized invitation for a 1.5-hour meeting for an individual or your team to sit down with me and the new Bureau Chief for Behavioral Health. Because this is such a priority, we're prioritizing those one-on-ones specifically around behavioral health, but we leave the last half hour in case you wanted to talk to me about other initiatives. We have put a 1-page document that's 2-sided. The first side provides specific data for each ward, and then the opposite side is a resource side where you have the number for the new bureau, you have the email address. We've put together behavioral health resources that are specific to your ward, so QR codes, addresses, times as well. But then if you want Narcan, who do you call at the health department? If you want this, if you want that, so we put an FAQ and even a list of resources. But it's a big thing that we want to be able to put on refrigerators for you, but people in your ward to be able to say, oh my gosh, I want to talk to the health department, I'm going to call. Dr. Gary has worked very hard, and she will explain to each of you individually in those meetings that we've already had and that all of you will have, is, if you choose, is how she structured the new bureau, all the services they're having. So she has a second pamphlet that is a primer to the new bureau. I love it so much. And Alderwoman Spencer brought her policy person, and he was like, I want 300 of these. And so it's like a pamphlet that you can open, and it describes everything that the Bureau does in very bright, simple language with pictures to really define it. Potentially, Alderwoman Boyd can explain her experience when she met with us and how helpful she may or may not have found this meeting. But so the Bureau will be broken down to you, resources will be given to you. And then the next step after those one-on-ones is we want to bring back The great Melba Moore, who opened the door for me to be a female health director, used to have newsletters that each of you got. And in her newsletters, you had specific data for your wards and specific information for your wards. So we're bringing those back in addition to these specific one-pagers. Lastly, the Behavioral Health Bureau wants to come to your ward meetings. They want to partner with you on community events. So this is a way to open those lines of communication so that they can come and be with you. So we want to make sure that you have no excuse to say that you can tell someone who's struggling in your ward, if you want Narcan, call. These are their hours. This is who you can call. When they're not available, this is 988, and we can come and educate you. But we have one-pagers, pamphlets, all of those that you can have in both a computer format, but also we'll print them and bring them to you. We're at the discovery phase where we're getting feedback. So we're getting a lot of, well, I don't like why isn't the number more prominent? Or this is a lot of information. This is too little. So we're not going to be able to please all of you, but where there's like consensus or little things we can change, we're trying to get that done so that by January, you'll have those resources. I'll stop there. Alderwoman, does that help? And do you have any other specific questions about the Human
I
Bureau?
appreciate that. I look forward to getting more information about it. But just for those watching at home, can you provide, your thing that you're happiest with how the work is going so far? I mean, I know it's a long process of a lot of data gathering, and I know that there were stakeholder focus groups and a lot of that happening, but just a moment in time, drugs abuse and the effect on our communities are so extreme that I think people want to know that what the city is doing. So if you think that there's some kind of short programmatic that you can share, and I do look forward to hearing more about all of this myself.
Thank you for providing me that information. We are most excited, and I'm just frantically trying to provide. You guys are going to get a little preview of the second ever annual report that we're giving. And there's one page here that if I share screen, I think will hit this home. So preview coming to you, our second ever impact report. We're in the final stages of this. We have updated it from last year, and we're working now with WashU to make it even cleaner. So next year's, but one thing I'm most proud of is the Behavioral Health Bureau really worked to raise funds through grant funding, and we put them back into the community. We've already put back over $275,000 to our Overdose to Action to fund grassroots organizations that are doing important behavioral health work. So because the group is still small but mighty, we prioritize. We have been meeting monthly with a coalition of over 26 partners in behavioral health and getting feedback from them. And they wanted money. They wanted support on how to apply for that money. So we're providing not only the money, but the support for them to apply and to keep it. We've done an additional $500,000 through other initiatives from ARPA. And there's about $1 million more that we'll be able to report has gone back into community. So that's one of the biggest ones. But if you look at the whole community will be able to see this impact report, but just some highlights. 800 number of overdose drug naloxone has been handed out by this small team of 10, just under 10 folks. Over 2,500 residents have engaged through outreach and education. More than 10 mental health and substance abuse training courses have been completed by staff, in addition to attaining peer recovery support certification. 50 is the number of outreach events that they've participated in. 20 to 25 is the number of calls received weekly already, even though they haven't even been 6 months old, from residents seeking mental health and substance abuse, because they now know that the health department will take the burden off of you, and we will link you. We will make those calls. We will call Department of Human Services. We will really make those links. Again, I said 275,000 is the amount of awarded to grassroots already, and we have an additional $500,000 that's still coming. From staffing, we have a linkage to care, 0 out of 1 positions filled, outreach, 1 out of 1, education, 2 out of 3, criminal justice, 2 out of 3, admin, 1 out of 1. Direct care is the hardest because salaries are so disparate for direct care services that we can't compete. So we have not filled any of the 4 direct care yet. We are working on it. You'll get more on the different building a strong and positive teen culture, linkage to care, outreach, education, and the criminal justice, what that looks like in this report. But I'll stop there and say, if that's helpful, that I've given you a little bit of a teaser of what we've been doing and what we've been prioritizing.
Yeah, that is really helpful. It's good to know that there's a direction number line for folks to call who have behavioral health issues or need to connect someone to them. You mentioned working with the Department of Human Services. That work is is so important. You know, a lot of times in my neighborhoods, there'll be someone who is a concern for the community, whether they're unhoused or whether they're kind of wandering, or, you know, different concerns about their mental state, or whether or not they're on drugs. You see some behaviors associated with squatting and all the safety concerns that come along with that. So are those the sort of instances when someone like me or someone in the community reaches out, you and the Department of Human Services are coordinating
Yes.
around those
So
issues?
that's our job. Because I can't provide clinical services, I have to get innovative about what gaps am I filling innovatively that no one's doing. And those are the types of things we're going. I'm going to share screen real quick. So another preview for the one-on-ones. This is what you'll be seeing. The first page of the first pamphlet is your ward. At the very top is the email address in a big box. We've been told to make this bigger, brighter, but the telephone number, that's the bottom line of what it is. But BHB facts. What do I do if I'm worried about a loved one's mental health? What do I do if I find someone who is overdosed in my community? What do I do if someone is suicidal or having? So we give them those exact numbers. In your ward specifically, you will have the locations of some of the providers that are there, where they are, their phone numbers, their hours, a QR code to make an appointment or request services. And then we have another partnering with our bureau. If you want to contact our outreach and neighborhood events, contact here. If you want to do linkage to care, so you need to be linked to services. If you need Narcan, if you need education, if you need policy initiatives, if you need funding, right? And then the second side of this is specific ward data that we've been given a lot of feedback on, so it may not look like this as well. We're getting a lot of feedback about ward versus neighborhood. People don't think as wards. So we're going to try to revamp this to make this more helpful to you. But this is the first piece of information that we have. The pamphlet I spoke about, so you've got to think about this folded. This is the front, this is the back, contact, phone, email, business hours, when we're closed. Our vision and mission is the other side. And then on the inside, what are our services? The definition of behavioral health, the City of St. Louis's vision and mantra, and then a little definition on what we're doing right now. Narcan distribution, linkage to care, community outreach, our peer advisory board, coalition building, and education. So we can print as many of these, you will have them in hand. We just want to get feedback to make sure they're what you want before we give them to people in mass. And we want to meet with you directly to just talk specifically, because every ward is different. And so far, the first two meetings, the concerns have been very widely divergent. So we want to make sure that the ward specific ones are also helpful.
Thank you. I really look forward to learning more about that. This is such important work in our community. It impacts so many different things. So thank you. And I appreciate your time today.
Thank you.
Thank you, Dr. Mahdi. The only question that I have, but I don't really have a question, because I think when we met, we did speak on it, and I don't think people are aware of it. Our senior population is impacted by the STDs.
Yes.
And people always look at me strange when I tell them that. I was like, no, they are impacted, and they're more impacted than what you think they are. And so just for the committee to understand, Dr. Mahdi and Julie were very informative to give me information about that. And so I was glad that they are focusing on that, because they know it is a dire need to address. And then the other thing, Dr. Mahdi, I'm seeing all these programs and departments. So how is that impacting you in regards to your budget and staffing? Because I know you don't have not even 10% of the staffing that you need, and your budget, how is that impacting your budget?
Thank you for that question. Because budget is so significantly a challenge, listen, this mayor inherited the way that the budget is for this department, and this mayor supports me unequivocally. However, the disinvestment in public health that the city has deemed appropriate for over a decade, we've got to fight back. Having less than 1% of the city's budget is not enough. Not having clinical services for the community is not enough. It's clear that the health department, which I've grown since I started, when I started, we had just under 85 people. Even with the highest turnover rates that we see in the city, we have over 127 people. Like, we're actually outgrowing the space here. You know, it's going to be more costly for me to purchase, like to build new offices and cubicles. So we do good work and yet we don't get prioritized as much. And I'm not asking for a lot more, but I think we've got to really have a serious conversation about the commitment to public health. Do we want clinical services? A lot of people in the city don't even take us seriously. If you go to the county, you walk into their building, you don't just talk to people, you can go into a clinic room, get your blood pressure measured, but someone can help you with the medication. I can't do that. And and you have one of the best health departments. We've been cited by President Biden. You see me not just regionally invited, but nationally invited. And yet when I come home, I can't even deliver these basic clinical services. That will take time. And this mayor is supporting me more than anybody, but we need to really have a serious conversation about what is our goal for the health department's budget and what does that look like? So I've started my budget process even a month earlier. The commissioner that we were able to ascertain, who has 20 years of high level experience in budgets, contracts, infrastructure, in this new report, in her page, you should see what she has done to help us. I think we are now preparing that, and I'll be very happy to come back and talk to you when we have it at a much more firm state. Last year, the big focus was building a new bureau. So behavioral health got most of the new positions. So the other bureaus have been flailing. So now I've talked to you about communicable disease and maternal child health failing. Well, sometimes they only have 2 people on staff, right? So if you agree with me that these are 2 serious issues, we now need to build some of the infrastructure and staffing around some of the other bureaus, some of the programming, but a very serious long-term conversation about how much we want to really increase the overall budget of the health department so that clinical services and other things can come back in the same way as most health departments across the nation provide.
Okay, thank you. So does anyone else have any questions? Because she gave us a mouthful, as Dr. Marty normally does.
Listen, you better think twice before you invite me, because it's gonna be a loud, passionate, and hopefully a good ride. But this is why I came. I didn't leave clinical care. I love taking care of patients. That's my life's work. Not seeing patients for 2 years has been the most difficult. I'm a clinical person. I'm a bedside person. But this, for me to be here, and most of the people who work at the city and give up the kind of salaries they could get, that's passion work. And I know I'm preaching to the choir because it's passion work for y'all, right?
Mm-hmm.
But that's why I show up the way I do. That's why you all show up the way you do. And I just appreciate the opportunity to have these discussions and to work with y'all as we come into this new budget cycle, but specifically right now around STIs and maternal child health.
And so I have spoken to some of our members, and we are concerned in regards to health, period, because it seems like everything that's going on in our city in regards to crime, the homeless, the issues in our community, it keeps going back to health. And so we are clear that we have to address this. And so we have to be strategic and ensure that you might not get 100% of what you need, but we can fight to get some of it so you can start making some kind of improvements. And
listen, we need to be fair to this administration. You can't undo decades of dysfunction in 1 year, right? But it's my job to push. Like, I'm a thorn in the, like I'm like one of their favorite, but I can be a pain, right? Because we push. Every director pushes like their department is the only one. But at the same time, it's going to take time to get us out of the hole that we unfortunately allowed Department of Health to be in for over a decade.
Right.
If you ever see a Department of Health employee, you thank them, because for every person you see is doing the job of at least 3 people on any given day.
Right.
Every single one of them. That's facts. So thank you for those observations, Chairwoman and Alderwoman. I really appreciate your leadership and your invitation today.
All right. Does anybody else have any comments? Questions? Okay, so we don't have any written testimony. Did we get any written testimony in regards to that?
Thank you, Alderwoman. I was raised right, so I just want to ask, am I okay to leave? Because one thing I'm not going to do is on your watch, sis. I'm not going to log off. So am I okay to be excused?
You are fine, Dr. Marty.
Thank you so much for having me. Have a blessed day, everybody.
All right, be careful. We have any announcements? Does anybody have any announcements for us for the health committee? An excuse older people is Alderwoman Tyus. That's the excuse older person. On that note, I'd like to adjourn our meeting. Could we get an adjournment?
I move that we adjourn the meeting.
Second.
Alderman Balmer like these kind of meetings, short and sweet. Thank
That's
you
it.
all very much. Have a good day.
Thank you.